last but not least, probably one of our biggest fans, Nurse Melissa. Where are you at?
Right here. Hi.
Who like you literally like you blow us up on social media. I love it. But it's so funny because you're like our biggest like fan. We love it. I watch every one of those reels. So
This
it's
makes
so
me so
amazing.
happy.
So amazing. So okay, so you were part of what of NCLEX High Yield?
Yeah, so I did the live course in August. So a little background on me, I graduated May of 2021. I attempted my first go at the NCLEX. I had absolutely no idea what I was doing when I was studying. I was 75 and out and failed.
No, no.
Failed hard. And I knew I failed. Like I was like, I have no idea what that exam was. I didn't even know if it was a nursing exam. Like I was so confused. And then the second time around, I decided to tackle it a year later. It took me a whole year to like get the confidence to get back on track and start studying again and dedicate that myself to that time commitment. And so I studied and I actually found you like right before my second attempt. It wasn't a long enough time to like engage in your material and really absorb any of it. Like I think I had a nursing friend of mine had introduced me to you and I started listening to some of your podcast episodes and that was it. So I went in and I was 145 and failed. Both times I like knew in my gut that I had failed. So again, I was like, okay, well, I'm gonna have to try this again. And I decided to really engage in all of the material you had. So I started coming on to the free Zooms. And I remember on a free Zoom, you had said something like, you know, as a nurse, you're gonna earn like hundreds of dollars a day, right?
Yeah,
Like in the
yeah.
grand scheme of things, the cost of like the on demand or the live course is so insignificant to what you're gonna earn.
What you're going to make. And just by the way, and I don't want to interrupt, but I'm
Yeah.
going to interrupt. Do you see how many people are hyping you up right now? They're just like your videos are inspirational. Like that's amazing. Look at them. Look at everyone. They're going off on it. Exactly. Look at your husband cheesing. Who's cheesing behind you?
My husband.
So it's so great what you've done for us. It's awesome. What like your TikToks and what you've done. It's again, but I wanted to point it out. So, but
Thank you.
nonetheless, continue.
I didn't actually notice because I'm looking at you, and it's so cool to be talking to you. I feel like you're my best friend. Like I feel like I'm knowing
Hello.
you so well through the on demand, right? Like I hear your voice all the time, and so it's so nice to talk to you face to face. But yes, I'm your biggest fan, and he's my biggest fan, so he's in here with me.
Well, you know, it was
They're waving at you.
it's a journey, right? Like we go through it. People don't realize how much we got to put in for them to go through their boards. So yeah, it's a big deal.
He went through it too. Um,
Yeah.
I'm pretty sure I have some like extra gray hairs from studying for the NCLEX. Like, oh yeah, you basically did that with me. But yeah, so I decided that, like I said, I was on a free Zoom. You had mentioned like it's such an insignificant price to pay when if it helps you get over that NCLEX, you're gonna be earning amazing money as a nurse. And
Yeah.
that really clicked for me because it really was like the money was kind of holding me back and I was like, I don't know. And I just was like, you know what? No, like I got to make this happen because he's so right. And I realized I couldn't afford not to do it because I knew that if I did the live course and the full program with you, that you're with us until we
Till
pass.
you pass. That's it. Yeah. We're with
Me,
you.
that was priceless. Like that's worth every penny and then some. And the price doesn't even matter at that point because if you're with me until I pass, then that's a guaranteed pass for me. And
Yeah.
so no matter even if I take it again and I fail, like I'm gonna pass at some point. So that to me was when everything clicked and I was like, okay, I'm all in. I'm gonna do NCLEX High Yield. I'm gonna do the live course. So I signed up for the live course in August. And I love the way you design your programs. It's so brilliant because I was on the Zooms in the first couple of weeks, and then I had some real bad tragedies happen in my life. I had a lot of loss in a very short amount of time. And so I actually wasn't able to continue on with like the live Zooms. But I was like, you know what? This is okay. I can come back to this because you have access to on demand for as long as you need
Until you
it.
pass, yeah.
And all the all the free like live Zooms that you guys do, you save them for us to go back and watch. Like you have unlimited access. So I was like, okay, it's not the end of the world that like I have to step away from this for right now. I'll resume it when I can. So I resumed it in October, beginning of October. And I spent 8 weeks in this office at this desk, just going through, powering through every single on demand video, all of the Zooms. I attended every single like weekly free Zoom, everything I could. I was listening to podcast episodes in my car, at dog walks. I was listening to all the time, right? So I just realized like I'm gonna throw everything I think I know in the trash and I'm just gonna like relearn everything with you. And I'm so glad I did it that way because, like I said, your voice was in my head when I was doing my test, and the method relieved so much testing anxiety for me. And I got so many questions that you taught me. And I was like, I know this.
Nice.
I know this. I know this. And I was 81 and out.
Let's go. I love it. I love it. So so how about your job interview?
Yeah, so this is the part.
Talk to me. Talk to me. So we're gonna go a little bit over, but talk to me. Your job interview.
Yeah. So when I was also attending the live Zooms, I would hear people who had passed, just like I'm talking to you guys right now. And they would say, not only did you help me pass the NCLEX, but you made me a better nurse. And I've heard so many people say this to Dr. Z. And I was like, wow, that's really cool. Like, ultimately, that's the goal, right? And you have made me a better nurse.
Oh, thank you.
And I can already see it, like in so many ways. But something that was really profound for me today was I had my first interview with with a hospital to be a part of the critical care float team. So floating between the ER and the ICU. So pretty intense interview for like a new grad. You know, I had to really prepare for that. But guess what I did to prepare? I went through all my on-demand notes. EKG lectures, all of that, and I got tested on it today. So
wow.
I got asked to read rhythm strips, and I knew them because Dr. Z taught them to me in the on-demand videos. And I also got a question. It was, you are in the ER, you have 3 patients that walk through the door. Which one do you see first?
Prioritization.
and
yes, let's go.
I know. I was like, give it to me, give it to me. And you would have been so proud. And they go, okay, so one's coming in with shock. They got shock. One has low BP, low blood pressure, and another one has a transfusion reaction. So which one's most urgent? And I was like, transfusion reaction.
Yeah, we talked about that. That's so funny.
And
we
I was
literally
like,
just talked about that. Yeah.
Yeah, and I was like, but then she said, I want you to explain why. Like, I want you to walk me through the process.
Why?
She even said, no right or wrong. Like, she's like, none of these answers are wrong or right. I just want to know your thought process. So explain it to me. So I was like, okay, the transfusion reaction, because yes, the shock is like a priority, but I have less time with the transfusion reaction because
less time with. You said it.
Because if something, if it escalates to, you know, a closed airway, then we have a problem.
Airway.
As soon as I explained that to her, she literally looked at me and was like, you just took it to airway. That's exactly what I was doing. And I was
there we go. Let's go.
NCLEX High Yield.
NCLEX, that's our hospital right there, right? So but nonetheless, thank you so much for sharing your story. And again, like this is what we do. We prepare you for the best, to be the best nurse, period. So nonetheless, any last words?
I love the nursing community. I live for it. I'm so glad Dr. Z has created this amazing community and that I get to be a part of it. And I just have to say, like, endless gratitude and thank you to you, Dr. Z, because ultimately at the end of the day, like, You created this program. You created these notes. The notes are incredible, you guys. Like, do the live course. Do the live course. I just want to say that to everyone. It is worth every penny and then some. You will pass. And I'm just so incredibly grateful. Like, I'm a better nurse. I feel like I have a knowledge that I've never had before and an understanding of nursing and medicine that I've never had before.
And you've got your number one supporter behind you.
Yeah.
Doing just, yeah.
He knows too now. He knows all.
That's what's up. That's what's up. All right. Well,
So
thank you so much.
Thank
you
you
so much. Thank you so much. I appreciate y'all.